I've connected with other donor egg moms. I think the biggest concern that most people have that I hear over and over again is that I'm not going to be able to connect with my child because they're not of my DNA, if you will. I think anyone that's been on the other side of it knows that's absolutely not true. I'm very bonded to my children. It's a process, and I want people to know also that if they think they can't do it, that's fine too.
Family building is supposed to be easy, and it can be a shock when it's not. The roller coaster ride of infertility can be a mix of emotions and conflicting advice along the way. As a reproductive endocrinologist and former fertility patient, I not only help patients build families every day, but I remember what the ride was like for me. Hang on tight as we learn together from experts and share stories from infertility warriors with compassion. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. There are many ways to build a family, whether it's trying naturally or adoption or IVF. One way that's not talked about enough is building your family with the use of eggs from a donor. Here today to share her own journey of egg donation to build her family is Dr. Shannon Clark. She is a full professor in obstetrics and gynecology at the University of Texas in Galveston. Shannon, thank you so much for being here today.
Thank you so much for having me.
I'm a fertility doctor, and I help people build families in lots of different ways. And donor egg, of course, is a beautiful option, just like all family building options are wonderful. But it's not something that people talk a lot about. And I really appreciate your being willing to do so.
Yeah, I made the decision very early on to be transparent about this because for the reasons that you said, that it's not talked about a lot. So yeah.
You were trying and doing fertility treatment on your own. Can you tell us just a little bit more about your story?
Yeah, so I married at 39 or so, had my first miscarriage shortly after our wedding. Then we kept trying for a few months. Then I was diagnosed with melanoma. So I had to have surgery for that, and that took a couple months to resolve. And now I was 40 and freaking out a little bit. So a good friend of mine is a fertility specialist, and my husband and I went to him. And he set us both down, and I just told him, I said, talk to me like I'm not even a physician. I didn't want that to be a factor in his counseling because I wanted my husband to understand everything as well. So he kind of gave all the stats about being 40 and natural conception and what the stats would be potentially with IVF, trying to use my own eggs. And obviously we went straight to IVF from there. We did ultimately go through 5 cycles of IVF. We got to 16 embryos that were genetically tested. We did do genetic testing with all 16. Out of the 16, only 1 was chromosomally normal. And that was on the 3rd egg retrieval that we did. That was transferred and failed. Then we did 2 more after that. So then, we were pretty devastated, obviously. Even though it was 1 embryo, we still had a lot of hope because it was genetically normal. We decided, what about egg donor? And my fertility specialist had actually been talking about it all along. So it wasn't like I had an epiphany or anything about an egg donor. But after that first transfer failed with the only genetically normal embryo we had, I said, let's talk about it. And we did. So we made the decision pretty quickly that we wanted to try it with egg donor. And this was something that I had absolutely no control over, which is also hard for physicians or type A personalities, like I'm sure you are as well. We're not used to not succeeding and not having any control.
And that's such a part of infertility or struggling to have your family is we're sort of taught our whole life that we're in control of our fertility because we can control when we don't want to get pregnant pretty well.
Yes.
But then we don't finish that narrative. We don't finish the second part, which means like when you are ready to conceive, you might be in control. It might happen when you want, but it might not. Who do you think had the tougher time in making that transition from trying with your own eggs to trying in a different way?
I don't think either one of us did, actually. For me, it was pretty much a no-brainer. I think it was just, you go through 5 cycles nonstop. I was also working. I was also in the period where I was trying to do enough at work to get promoted to professor. And, I have a very demanding job and I just was spent. So it was just a matter of when am I ready to take that next step? We did not have a hard time deciding to use donor egg at all.
That's great. Every person is different. And I have some patients that the female partner is really going through a lot of grieving. Like, I really imagined that I was going to conceive like I see it in the movies. And then I see other female partners that are like, oh, this is great. Finally, something that has like a really high chance of success. Like, sign me up. I'm ready to have my baby. And then I see the male partners sometimes really grieving because they married that person.
Yes.
And they want those, like, that person, those genes, or it's not the genes. It's just like grieving that.
A part of that person. Yeah. No, I get that. But to be honest with you, neither one of us were like that. At least my husband never expressed anything about that. And I can tell you, I'm pretty sure he didn't, because he really enjoyed going through the donor egg registry.
Really? Oh, tell me about that.
He did. So actually, I started looking at the egg donor registry first. That was actually the most difficult part for me, because it was hard. I felt like I was finding, which I was technically finding someone to replace me. And I couldn't do it. It was tough. So I went to my husband. I said, listen, you're going to have to pick the person. I said, you go through the registries. We have an idea about what we're looking for. Well, he went crazy. He was looking at registries in California and all this, and, a dozen registries. He was making an Excel spreadsheet. And I finally looked at him and I said, Renee, honey, this is not Match.com. You are not going to find the perfect donor egg or egg donor. I said, I'm not perfect. The person's not going to be perfect. I said, let's pick the top 5 things that we're looking for. I said, I want to stay local. I don't want to do this cross country, in our general area, maybe a city away within a few hours. See how many candidates we get based on those 5 criteria. Well, we ended up with 3.
I think that is just adorable about Renee, because can you imagine? He's watched you go through all of these egg retrievals and shots, and he's like, finally, this is my job. I can do this. He's like, I'm going to do this really well for us, and I'm going to take control of this selection. It's really sweet.
Me, I make a decision, bam, there you go. Go and move on to the next one. He's not so much like that. He's very cerebral. So he takes things very seriously and he takes his time. So, and which is great because it balances my craziness sometimes. But like I said, after we found the 3, our first choice was actually available. So then the journey began.
What are the things that were kind of going through your mind? What was important to you, and how did you get that information?
I was very simple about it, because I knew that anybody that was on an egg donor registry had gone through crazy screening. I didn't get bogged down in the minutia of it. And it's like, let's just be simple. What are the top 5 things? I'm a redhead. I have blue eyes. There's not a whole lot of redheads back then, at least. So what's the next most likely thing? A blonde. Blue eyes. Bam, got it. I'm 5'7" and above. Bam, that's the 3rd one. What was the other criteria? Local, and then some form of education past high school. That's the 5 criteria. You would think there would be a gazillion people like that, but there actually wasn't. Once you start narrowing it down, we got the 3 people. Those are the top 5 things, and that's what we picked, and it worked out for us. I wrote about it every chance I get because I couldn't help but think through my whole entire process, actually. If I'm a physician, highly educated, all these accolades and degrees behind my name, and I'm actually in obstetrics and gynecology. I'm not a fertility specialist, but I'm a maternal-fetal medicine specialist, and I've had education and fertility things regarding women's health. And I didn't know, and I wasn't prepared for what I was going through. What does the person who's not that educated and actually in the field, what do they think? What do they know? What don't they know? So I made a decision very early on to be transparent, no matter what that meant. I was very supported, both obviously by my family and by my bosses at work. They were very supportive of it too. So I had a lot of support all the way around. I did have a few people come to me and say, are you sure you really want it? Why do you want to tell the world about this? And I'm sure it's not always positive. There can be some very dark things that people can say. But I'm one of those people, I could handle it. I could compartmentalize it, and the good far outweighed the bad. And I do know that I've helped a lot because I can tell by the messages I get, emails I get from people who just need someone to talk to about it. So it's been a very positive experience just sharing my whole entire journey.
Oh, I'm so thankful that you do. And I feel like donor egg is so much more common than people realize. It's a big part of my practice. People are so much more open about sharing adoption, which wasn't always the case back in the 60s. And people are very open about donor sperm and even surrogacy now, but kind of the last thing is donor egg. And I think it's because when you don't talk about things, they're able to hide in the shadows. You're allowing the misconceptions to come forward, and it allows it to be surrounded in shame. And that's not okay. I mean, that's where miscarriage has been for a long time. It's where infertility has been for a long time.
There's a cultural component too. And I think it has to do with sexism in society and the way that we view women. Women are not allowed to not be able to produce kids. But if a man can't, just use a sperm donor. There is a double standard there. And it's especially true when it comes to certain cultures and certain religions. I mean, dozens of people I know, they used an egg donor, but no one in their family does. It's between that person and their spouse and me, because they got information from me. And these are not my patients. These are people who just reached out to me and couldn't because of cultural, issues or religious issues. And that is a factor. And it's something that we do need to talk about.
Can you remember some of the things that have been said to you when you were going through this that you're so glad that you have that thick skin?
Oh, I mean, anywhere from there's a reason why you can't reproduce because God doesn't want you to. And then one of the biggest things is I'm selfish because why don't I just adopt? And that's the biggest thing I'm sure a lot of people going through fertility treatments gets. I don't want anyone to think we didn't think about it. We did think about it. But I'm an OBGYN. I have been around pregnancy my entire career, and I wanted to experience it. And I was fortunate enough that I had the means to go to the lengths that I did. But adoption was never ruled out. Sometimes carrying a pregnancy and having a pregnancy is important to the individual. I just think it's not a fair argument to give to somebody or to say they're selfish because they're not considering adoption. But adoption's not a guarantee either. And it's just as long of a road. It's just as expensive in many cases. So I also think that that's something that should be talked about as well, because it's not an easy fix. And it's not like I could have just gone and adopted a child. And that's the case for many people.
I have people who have actually been trying to adopt for years and then come and say, what can you do for me? Because it's more of a journey and a road than I think people realize. I think the two words that should not go together are just adopt.
Yes. Why don't you just adopt? Yeah. But people can be very, very cruel. I realize that some people just are that way. Some people have their own issues and are lashing out for whatever reason. And, you just have to kind of put that where it belongs and focus on the positive, which is what I've been able to do, thankfully, all this time.
Did you have any resources that helped you when you were going through? I can't imagine there was a lot of social media discussing this or books or...
No, but that's me. That's not me, though. I'm not one to scour the internet. I'm not one to try to find a lot of resources, because I find for myself, at least, that causes me more stress than helps. I trusted my fertility doc. That was my resource. You have to have that relationship and that trust with your fertility doc. If it's not there, it's not going to be a good journey for you. If you feel the need to continually go to Google or ask Facebook groups or mom groups or infertility groups, questioning whether or not what is being advised is correct, then you don't have a good relationship with your doc, and it's not going to be a good journey for you.
How about emotional support?
That's one thing that looking back, that I dropped the ball on. I didn't have it, but I also didn't ask for it. And I think that goes along with the type of personality I have. Being type A, being able to fix things myself, trying to control the situation. Also, hiding in my work and diving into my work so I didn't have to think about things, because, listen, I was delivering babies when I was going through all this. I was also counseling women on pregnancy loss through all this. It was not easy. So I had to be one person when I hit the door at work, and another person when I came home. I would advise anyone that's going through a fertility, starting a journey similar to mine, that they do get a support system, whether that be friend, family member, a therapist, anything like that. I wish I had done it then, because I realized when my twins were about 2.5, that's when I started going through, like you mentioned earlier, the grieving of my previous losses, the trauma that I experienced from being, going through fertility treatments, then having a high-risk pregnancy, and it just caught up with me. People ask me, what's the one piece of advice you would give? Have a therapist, see a therapist, have a support system. You've got to do that from day one.
I really appreciate your saying that. Honestly, now you're speaking out and writing and sharing your story is actually providing some support to some women. It's like you're being that person that you kind of maybe wish was there years ago.
I've grown quite a bit over the last year. But it does make me feel better to know that I am educating and I am having a donor egg pregnancy out of the shadows. I actually talked to someone last night who's been through pregnancy loss, and this topic came up. Do I need to share everything? Is it my duty to help others? Because I do think there's some kind of expectation, because social media is so present in our lives, that we should be sharing what we're going through. And I told this person, I said, listen, you have to do what's best for you. You don't owe anybody anything. Just because myself or other people share their journeys doesn't mean it's right for you. And transparency should never be expected when someone's going through pregnancy loss or infertility, because it's not the right thing for everybody.
I certainly did not share when I was going through my own infertility journey. I wasn't on social media at that time. I don't know if I would have done that or not. But having someone feel like they have to do it. I'm so glad you gave that advice to that person.
But it also goes along with another aspect of donor egg pregnancy. And that is, again, social media is in our lives all day, every day, in one form or another. Is the whole thing with celebrities having babies in their late 40s, 50s. At first, I think it's becoming less of a thing now, but I think a lot of people got a false sense of security because they assumed that these people were getting pregnant on their own, when more than likely they were using donor egg just like me. So there's been a thought, well, they need to be transparent and they need to tell people exactly what they did. And my response to that is no, they don't have to. But it's not their duty, even being celebrities, to reveal how they built their families. That's not fair. But educating yourself, especially as you're approaching older age, like I was, about the realities of fertility and declining ovarian reserve with age is the most important thing. So that's why, another reason why I've done this is to make sure people are educated and start educating themselves sooner than later. And oddly enough, my largest demographic on social media is age 25 to 34, not 35 and above. That does show me that people are starting to want that information earlier.
As soon as a celebrity that's over 45 or especially over 50 announces a pregnancy, our phones start ringing off the hook. What can you do? How can you make this happen for me? And part of the bias is actually the media coverage. There are celebrities that are very open about using donor egg. Kelly Preston was open about it, but when it was covered by some of the tabloids, they just said IVF. They didn't say, even though she was open. But recently, it was within the last year, when Rachel Weisz and Daniel Craig announced that they were expecting. Rachel Weisz is over 45, and she didn't say whether it was her eggs or donor egg, just totally up to them. But the coverage in People magazine talked about age and fertility and how most women over the age, not saying that she did, but just they took that opportunity to educate. And I said, oh my gosh, thank you. Thank you. Wow. Way to go, journalist.
No one should ever say, well, I'm sure they use donor egg, especially in the media, because that's not fair if they're not being transparent about that. But, taking the opportunity to educate is the best way to handle it.
There's a real shift in the fertility world about anonymity with donor egg and donor sperm. And really, 10 years ago, it was very much assumed that everybody would want to keep quiet about it and that anonymity was really important, that we were nervous that if there were open information that we wouldn't be able to get people to donate. And then bias towards people who were getting pregnant with donor egg or donor sperm, assuming that they wouldn't want to share. What's drastically changed is genetics and these at-home testing and 23andMe, Ancestry.com, and there is no anonymity anymore. And I just wonder, did your donor, is she open?
The way the particular company I used worked is that they had asked me right before she started the injections, hey, can you write her a letter just thanking her, anything you wanted to write. And I said, this seems so odd to me. I said, can I just meet her? Which wasn't typical. And they said, well, we can ask. And she was 100% down for it. So we actually met. We also did a photo shoot together right before I actually went on bed rest. And I'm still connected with her. She has my contact information. I have hers. Recently, my daughter had a medical issue that I messaged her about, and she was helpful. And it's nice to have that. It's really worked out well for us. Again, I'm transparent, and my husband really doesn't do that because he has chosen not to, but I have that connection with her. But I also know of couples who want zero contact, and that's perfectly fine too. I'm just thankful that she was willing to have that relationship and that connection with me, because I think it probably helps us both.
Certainly, there's a medical reason that the donors should stay in touch with the clinic and the families should stay in touch because, people donate their eggs when they're 25, and it could be that at age 30, they find that they have a medical issue. So it's really good to stay in touch. And have you talked to your kids about it?
No, not yet. I don't think they're ready. But, there's actually several books out now about it. And, right now we're working on body parts and they're starting to learn that. I'm going to ease them into it. They will definitely know. I'm the mom and I kind of am gauging when they're ready. We're in probably stage 1 of the process.
So the intention is to share. Yeah. Yeah. And there are actually some wonderful children's books out there that are, from very little like preschool talking about like mommy muffin doesn't have all the ingredients, but this lovely muffin came along to the point of that great series called It's Not the Stork. And it's for different age groups, like age like 4 and under, 4 to 10. I don't know. I got all 3 for my kids and I just kind of put them in their room. And in there's actually like a IVF doctor in one of them. And I was like, hey, that's mommy.
One of the things we started with was explaining to them that they were inside my belly. So I wanted to lay that foundation first before I started adding on other things about how they were conceived, so that they know that they were a part of me at one point. So that's just kind of how we decided to first start the conversation. Even though it was not my egg, them being in my body, them being in my uterus does play a role. So that way I was able to pass a part of me onto them.
Anything you would say to someone getting ready to consider donor egg being their next step in their journey?
I've connected with other donor egg moms. We all have our own stories. We all had our own hangups, our own concerns, all of that. I think the biggest concern that most people have that I hear over and over again is that I'm not going to be able to connect with my child because they're not of my DNA, if you will. I think anyone that's been on the other side of it knows that's absolutely not true. I'm very bonded to my children. It's a process. And I want people to know also that if they think they can't do it, that's fine too. Some people can't, and for whatever reason. And you might go through this process of trying to figure it out, and if it's the right thing for you, and you may decide that it's not, and that's fine.
I have 3 distinct patient interactions, all in the grocery store. Not the same grocery store and not the same time, but just through the years, I've been doing this for almost 15 years, where old patients have come up to me and said, thank goodness all those treatments that you tried to do did not work. Because if they had worked, I wouldn't have this baby that I'm holding. And what I mean is they tried IUIs, they tried IVF, and then maybe they adopted, or maybe they did. I'm talking about the ones that are donor egg, and they're literally thanking me for all the failures in such a sweet way, because they said, if, this child wouldn't be in my life if that journey hadn't happened. And, I just wanted to share that with you.
I hear that too. I mean, you never know what you're going to feel when you get to the other side. And I use that term meaning that you get to the other side where you are able to have your family, no matter what path it took to get there. But I also want to acknowledge that there are people who don't get to the other side, whether it be because they physically can't, they're not candidates for adoption, they're not candidates, they don't have the financial means. There are a lot of barriers. Being able to go through fertility treatments and go through the extent that I went to is a privilege. But I got to the other side, and people know that. And I know they look to me when they're going through it and hoping that they get that outcome. And some of them aren't going to get that. And, I want to make sure that anybody that's listening to this, if you haven't been able to or not yet, and you're wondering if you ever will, I get those feelings where you just feel hopeless. I was just talking the other day to someone about that. How do I hold on to hope? And I told them, I don't have a magic answer for you. I don't have anything profound to say. It's tough. I mean, I know you've been through that with your patients a lot. It's tough. I hope that things change in the future where fertility treatments do become more accessible, where adoption becomes more accessible to people so that they can get to the other side, if you will, however that looks for them.
I do have the privilege of helping build families for almost 15 years. And so I can see people being fulfilled and happy and successful at the end of the road, whether or not they have a baby. That is the ultimate goal. That's why people are coming, and it will usually happen one way or another. But I also see people making that decision that they've done everything that they can, and it's time to maybe change paths and live child-free. And I love that you're highlighting that there's many different ends to the journey, and they can all be hopeful.
Yeah. And we have to think about all aspects of it, because there are definitely very different paths for a lot of people.
And how can people find you, Shannon?
Yeah, so I'm probably most active on Babies After 35 on Instagram, but I also do the fun stuff on TikTok at TikTokBabyDoc. But if you want to get the most information and education is going to be done on Instagram for sure.
Thank you so much, Shannon.
You're very welcome.
Thanks for being here today. Egg donation has helped build countless families. I'm so thankful for Shannon being here today and sharing her own journey through infertility as a physician and building her family with egg donation. She is fearless in her approach and her transparency. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. If you like this episode, let us know. Give us a 5-star review and follow the show wherever you listen to podcasts. Baby or Bust is produced by Mark Ramsey, Jamie Solis, and Greg Moga. Executive produced by Paul Anderson, Nick Pinella, and Andrew Greenwood for Workhouse Media. Baby or Bust is a Mark Ramsey media production.